Welcome everyone. Just giving people a chance to join us, but we'll make a start, I think, now, if that's okay. So good afternoon and welcome. My name is Grant MacDonald and I'm the Chief Operating Officer in the Trust. And I'm really just predominantly going to introduce this session and we'll be here for the question and answers. But I've got colleagues, Paula Hull, our Chief Nurse, who's going to give you an overview of the current position locally, regionally, nationally, around our COVID challenges and response. We are going to look at, with one of our Deputy Directors of Nursing and Heather Mitchell, our Director of Strategy, we're going to look at the issues around the vaccine and what we're doing about that, which obviously is very important to you and to all of us. And then we're going to have, most importantly, probably a session on questions and answers, because what matters most to us is what matters most to you. And really, there's lots of forums for information. The purpose of this forum is to have a slightly more free-flowing and informal discussion over the next half hour about what matters to you and see if we can answer things to help your understanding and help the way we operate. But more importantly, I think, to help us think about how we care for the people we serve and also each other. So really that's what we want to achieve, and this has been recorded, so this will be available for people afterwards. I think they're probably the key points I'd want to make. You've seen some of the etiquette about being able to sort of raise a hand, so to speak, and to put questions in the chat bar, and so they're up now, so I don't need to dance around this. So yeah, so make sure you're on speaker view, keep yourself on mute, and can you type any questions into the chat function, and you can use reaction buttons, so to speak. So really pretty standard stuff for us all now, even though I couldn't remember it. So I'm going to hand over, if that's okay, to Paula to give you an update on the current situation, and then when we cut at the end, Paul Draycott, the Director of Workforce and HR and Organisational Development, will take us through some questions. So over to you, Paula.
Hi, hello everybody. My name's Paula Hull. I'm the Director of Nursing and Allied Health Professions. Welcome on the call. You will have all seen the recent message from Boris Johnson and moving from a tiered system across the country to a national lockdown, and the very strong message to stay at home. That's had an impact for some people in terms of school closures. Key worker and vulnerable children should still be able to go to school, but what we've been hearing from people that in some cases, some schools haven't been as well prepared as others, and that's created a bit of an issue for some people, and we're trying to be really supportive and enable people in those situations to be able to obviously safely look after their children and sort out issues with them along the way. And we've also put a newly written communication which includes the word critical worker, which is the new wording that the government seems to be using to make sure that when you if you get stopped when you're doing your job, you've got some documentation from us which is very new and valid around why you are out and about. Cases across England are sharply on the rise, with the rate at 476,000.6 cases per 100,000 people. And in South East region in particular, there has been, as you know, a sharp rise in cases, both admissions to hospital and cases in our patch. And some of those have been linked to the new variant of COVID that we've been seeing in some cases in our different areas in our patch. Cases in Hampshire are continuing to rise with over 6,049 cases in the last 7 days. That's from the 4th of January, and we're seeing a sharp increase. We haven't reached the peak of this second phase. What we expect is that when we reach the plateau for community infections is when we then, about 2 weeks, maybe a little bit longer later, you start to see a plateau in admissions into hospital. So we're looking really closely at the numbers of patients in our community. When that starts to plateau, we will expect a 2 or 3 week window where admissions into hospital will start to decline. And obviously we're all looking forward to that position. Portsmouth hospitals currently have got the highest number of COVID positive patients. They've got over 400 people currently in their wards. And I know UHS as well have also got just over a handful of patients with the new variant. So we are picking up in different parts of the patch the new variant. And feedback from UHS is that with normal infection control procedures, our normal universal precautions, your hand hygiene, your mask and your PPE are satisfactory measures to keep the new variant as controlled as you would be with the original variant. Is there another slide here? So within Southern Health ourselves, we've got 31 COVID positive patients, 98 staff self-isolating and 42 staff off sick. And the number of staff self-isolating has obviously risen. So we're keeping a close eye on that. And some of you will be feeling the pressure of this. Staffing in a number of our ward areas and community teams has been really challenged. And I thank you hugely for your patience and your resilience and determination in trying to keep our patients and families safe under really difficult circumstances. We're pulling out the stops around bank and agency. We're offering lots of incentives for people, but also want to make sure that you don't overdo your working and that you take time to recover yourselves and that we don't ask too much of you, because this is going to be a good month's worth of challenge for us, and we need to take time to make sure that we don't become ill ourselves. But really thank you for the efforts that you're making. The COVID vaccine hub was amazing. I went to see it yesterday, and the people that are putting themselves forward for it are fantastic. There's a real sense of we've got this, we're working together, and that's amazing to see. So thank you all for that. Difficult times, I can't tell you enough, stick to your basic precautions. I know we're all tired, and sometimes when you're tired, human factors step in and it's hard to remember, but you're putting on and off of your mask. Even more important with the new variant, it's more sticky, it can be transmitted more easily through your hands. So the donning and doffing really carefully of your mask, not touching that mask and contaminating it, lots of hand washing. Those things sound really simple, but they work, they really do. So, please, if you need help with that, if you need support, if you've not got the right PPE, we've got a new head of health and safety, Andy, who's absolutely fantastic. He's talking to every single staff member who's been reported as having COVID-19, so that we can really talk through the learning and how people have managed who've had COVID-19. So anything we can do to support you, please let us know. Really wanting you to stick with the lockdown. I know you all are. I know it's hard, but we're absolute role models, and people look to us to see that practice, and anything as an organisation we can do to support you. Thank you all. And I think that's it from me.
Thanks, Paula. So I'll just update on the vaccination programme. So as Paula said, really pleased to say that our Oakley Road vaccination hub went live this week, and we had the first of our staff receiving vaccinations from Tuesday, and the staff have just been reporting they've been seeing lots of good staff faces coming through there today. So it's absolutely fantastic news. It is a little bit later than we were anticipating. So the reason we're only opening up now post-Christmas has been due to the national supply of the vaccine. So there was some limited supply of the vaccine to Portsmouth Hospital pre-Christmas, and we were able to get some of our staff booked in there during the Christmas period. University Hospital Southampton and Hampshire Hospitals are only just themselves going live within this week, the last couple of weeks. And primary care sites have been taking a phased approach of going live. So we've got a number of sites now across Hampshire that are up and running. Primary care sites are predominantly focusing on the wider population, the over 80s in the first instance, and I know some of them now moving into the sort of over 70s, over 75s. But our sites are focused on frontline staff vaccination programmes, and that is predominantly our staff, Solent and Sussex Partnership, who deliver our CAM services locally, but we're also supporting some organisations that we work in close partnership, like hospices, for example. The site is open 7 days a week. It's open for booking now. And there was some communications which went out in the staff bulletin yesterday, which provides the link on how you can book into that site. Oakley Road is our first community hub. We've got the ability to open another pod there, subject to vaccine supply and subject to staffing. And we're also working on getting two further hubs live, one which will be in Basingstoke and one which will be in Portsmouth. And we'll be sharing the location of those next week, and we'll be starting to sort out the staffing models for those, with a view that we open those within the 3rd or 4th week of January, but again, subject to getting full staffing models and subject to vaccine supply. The other area we are being asked to support on is for housebound patients. So you may have heard that obviously we've started off the vaccine programme, and certainly Oakley Road is up and running with the Pfizer vaccine, but the AstraZeneca vaccine is starting to flow now out to primary care. And we've got the ability now to take that out to care homes and to housebound patients. So we'll be looking at how we can support our primary care colleagues by vaccinating the housebound patients. So we're just working through that model now. In terms of prioritisation, we've said that obviously it's frontline staff plus people who are more clinically vulnerable. And obviously frontline is anybody who's in a patient-facing role or works within the teams that are patient-facing. So it does comprise the vast majority of our staff. As I said, the booking link has gone out. We've been gathering lists of people who wanted to come forward and get nominated for this programme. I know there's been some frustration about people getting a communications back around training, development and coming online. We've been setting up the initial hub with our most experienced vaccinators to make sure that we get it up and running in a safe way. But we, you know, as we expand and grow, there is going to be a real need for everybody to come forward. So please don't be disheartened. We will need people, and we'll be working and trying to forward plan the workforce and make sure we bring on people who've come forward around their training and development. And that'll be a mix of people who we can second, if you like, into those roles on a sort of a more permanent basis, you know, for the period that the hubs are open, plus people who might want to work on more of a shift basis. But we will need a combination of that within the workforce. The only other thing is to say that the site is up for booking, but if you are not one of the people within the priority groups, if you are sort of working at more of a home-based environment, you're not coming in direct contact with frontline staff or working on our sites, then we do ask you to hold off booking a slot until we've got through those staff who are more at risk of COVID transmission.
We've got quite a few questions about the vaccine. So I think the first one Paul has answered in terms of whether Oakley Road is for the public, and I think Paul just said it's just for staff. Next one is Gareth. Is there no option to open a hub in Lymington / Southwest, as there's lots of staff down there? I'm going to pick that one up, and then we'll go to another couple of questions.
Yeah, in our initial planning, we were looking at a model whereby we could potentially take the vaccine more out to staff, but we are somewhat tied by the national programme, which is that they need to be named hubs, working to a clear protocol and model. They need to be nominated to the national team to get on the supply chain for the vaccine. So I think the short answer is no. we will have to bring people into the Oakley Road hub, the Basingstoke hub, or the other hub. But you know, if we can do it a different way, we can think about it. But at the moment, that is the case. It needs to be those hubs.
Thanks, Heather. Then Laura's asked a question: will staff just be offered the Pfizer vaccine, or does it depend on supply as we work through the programme?
So there won't be a choice of vaccine. You know, if you want to come forward and book, it will be based on the vaccine that's available on that site. At the moment, at Oakley Road, it's operating with the Pfizer. That may change in due course, but that's the vaccine that we have available at the moment for staff.
Real, I think then vaccines, can staff choose which vaccine are concerned about travelling to different site? I suppose that's so presumably that's again, sorry Maxine, I don't know whether that's for shielding staff.
I think what's likely to happen is that we will have Oakley Road delivering the Pfizer vaccine. The other hubs, I don't know, they might be set up with the Pfizer vaccine, they might be set up with the AstraZeneca. It depends on the national supply. But those sites are likely to only have one type of vaccine available. So at the moment, it's the Pfizer that we've got access to. It's the Pfizer vaccine at Oakley Road site, and it's the Pfizer at the acute hub sites. So that's the vaccine we're working to. And the AstraZeneca is being used because it is the vaccine that can be more mobile. That's been taken where it needs to be mobile to the care homes and to the housebound.
And then we've got a couple of questions, one from K.A. Stevens and one from Leanne. I think Paul has answered the Leanne one. So about NHSP workers and student nurses getting access to the vaccine. Paul has already, I think, answered the one from Leanne about student nurses and having access to the vaccine whilst they're on placement, which is of course yes. And similarly, NHSP staff, I believe that's the case too, isn't it?
Yeah, there's been some guidance come out to clarify that today, and yes, absolutely, bank staff.
And I think, yeah, the question there is also who do you need to contact? Who do you need to contact to book because the manager's off sick at the moment? Is that just a case of getting onto the portal and?
Yeah, well, if your manager's off sick, there ought to be some kind of hierarchy. But if you're staff, then you book through the portal, and the link's gone out in the staff communications. If that question is about people who aren't our staff who need access, then I'd suggest talk to divisional leads or put a query into the COVID vaccination query box.
Brilliant, thanks Heather. Okay, any other questions? Lots of questions around vaccines there. What happens if the first vaccine you have, Pfizer, for example, is then not available for the second vaccine? That's a great question. Yeah,
do you know, I just asked our chief pharmacist that exact same question. We are, where possible, trying to make sure people have the first and second vaccine of the same doses. So if you've gone to the Oakley Road site and had your first vaccine, we will try to, when we go to rebooking and we open it for rebooking, then you go back there and hopefully we'd have the same vaccine. But it does seem that nationally, you know, they're looking into that because it, you know, if national supplies run out, that might not be the case for everybody. But at the moment, we're trying to manage the process where you have your first and second of the same vaccine. I'm sure there will be more national guidance coming out about that, and more testing around that as time moves on.
And Diane has asked a question: are you happy that the 6-week interval gives the maximum immunity as the trials worked on a 3-week interval?
So I'm not clinical, but have been an awful lot of clinical clever people looking at that on a national basis. So
efficacy from your first vaccination is about 52 to 68%, and that's usually within 7 to 10 days. The second vaccine is usually about increasing that immunity and then prolonging it so that actually you get that 6 months to 12 months cover. So yeah, there's been a lot of work done on looking at pushing the second dose date out and the impact that it has. And at the moment, your immunity is pretty good after your first dose.
Thanks, Paula. Donna's asked a question about Basingstoke and the vaccination programme up there as it's close to Reading. Am I right in assuming that the vaccine will be given from AstraZeneca. Have we got any indication?
Okay, it's not Hampshire Court Hotel. I'm not actually allowed to say which site it is. So the Hampshire Court Hotel has been set up as a primary care hub, and the primary care staff in Basingstoke have come together and they're delivering it from a hub. So that one is targeted at their GP list population groups. It's not a staff hub.
But some of our staff accessed it over the weekend.
Yeah.
They have been supporting us, that is true.
Yeah.
But that's not their primary focus. So our staff hub will be at a different site, and we'll be announcing that next week. I don't know, is the honest answer, which vaccine will be supplied to that site, whether it be Pfizer or AstraZeneca. But yeah, we won't get a choice in that. That will be dictated nationally.
And do we know whether the vaccine will be suitable for vegetarians, vegans? Have we?
I believe it is. I think there's been some.
I'm pretty sure it's not using animal products. I'm pretty sure both of them are. We would need to check the details, but I'm pretty sure that is the case. And the PCNs, the primary care networks, have been absolutely incredible. When they've got any DNAs in their patient group, they get onto us, and we have to very quickly, sometimes over the weekend, even on New Year's Day, we got a call from them saying, look, we think we've got some spare vaccine, which is why you might get a sudden request to very quickly go somewhere close to you in a different site. So people are really trying to make sure that staff get included in a range of different areas.
And yes, it's been confirmed it's okay for vegans.
Yeah, I thought it was.
FAQ, which I think covers some of these questions, which is also available on the staff com.
Fab. Margaret's asked a question. Are we going into care homes, nursing homes, shared living homes? If we are, how are we ensuring that service users who are receiving the vaccine are consenting to having it? Some of these people may not be our service users, but are still offering them the vaccine if they're in the home, or is being by primary care.
So at the moment, primary care are predominantly supporting the care home response, and they aren't asking for us to do that. They are going to be asking us to do the housebound response, and we should be in a position to be able to start with that programme either next week or the week after. And we will be consenting either through the primary care practice or through our nurses. We're just working through the protocol on that at the moment because the guidance is just coming out. But people will be consented through that remote model in the same way you would if you'd come to a hub.
Brilliant. And Maxim again, can staff from Southern that work on Hampshire Hospital's site, can they have the vaccine there, or do they have to come to the Southern hub?
So we are in conversations with the acute trusts about getting access for our staff. At the moment, HHFT only got their vaccine at the beginning of this week, and they've been prioritising their staff. But I've got a conversation with them later on this week to see whether or not we can get some access. So it's a case of watch this space really. But the acute hospital hubs, as well as our community hubs, should be supporting all staff groups eventually. It's just people have only just got the supply, and they're tending to prioritise their own staff at the moment.
And on that, Natalie's just how will Hampshire Hospitals let staff know if there's a spare vaccine? So
they will come through us, probably through the vaccine leads, because they've got our contact details because we've reached out to them. And then we'll approach the divisions if there's a short notice area to identify people who would be prioritised at the moment. That may change though. There may be a bit more of an open access in the weeks to come.
And Julia, I think is preempted, thank you. What kind of allergies will prevent you from having the vaccine?
Yeah, I'm going to defer that one, definitely.
Hi there. So obviously in terms of the national protocol, that talks about an anaphylactic reaction or carrying an EpiPen and requiring hospital admission. Having said that, and having done some of the clinical assessments this week, there have been some staff members where we have made the decision that due to the type of allergy that they have had, and the type of reaction that they have had, we have advised for them to have their vaccine done through the hospital hub. That probably is a bit of a belt and braces, really, and we're making sure that that pathway for transition, if that is a requirement, is smooth if that happens when you arrive at the hub. But we're also thinking about how we can improve more information up front so that people know which way that they need to kind of have their vaccine.
Brilliant, thank you. And one, you might be able to answer the last question. Jan asks if it's a live vaccine.
No, it's not a live vaccine, no. So basically how it works is it has what's called an RNA, which is ribonucleic acid, which is injected. That helps the cell to activate its spikes, and as a result of that, your body immune system will release its T cells and its memory cells and give an immune response, and that gives your immunity kind of going forward. So that's how it works. It's not a live vaccine, so you can't get COVID from the vaccine. It's important to say that the immunity doesn't come online till those kind of start till that 2 weeks time. So even though we're advising staff that they might get some symptoms in terms of post the vaccine, it's also people being live to the fact that they potentially could still be COVID positive. So keeping the lateral flow testing going is really important for staff that are coming through having the vaccine, and as has already been reiterated about doing their kind of social distancing, etc.
Great, thank you. And just one last one for the team, for the comms team, to pick up with gold. S. Edwards has put in that a few times that I've tried to email staff vaccination email address, it's not been recognised. So can we just make sure that that's working? We've got the right email address and the right link.
So I'm wondering whether he means it's not been recognised or not been responded to. So I know we've had a huge influx of emails into vaccination address box, which is not surprising. We've just started the vaccination programme this week, and I know staff have been really keen and really anxious to get access. So my apologies if the communications have not been as slick as they could have been, but
it pings back apparently.
Okay, it pings back. Okay, we will check that then, because that should not be the case. And I know a lot of people are managing to get through, so we'll double check that.
That's brilliant. And one last one before I hand back to Grant, from Catherine again. Is there any way we can check whether we can have the vaccine prior to attending the appointment?
Oh, in terms of allergies, does that mean, or?
I'd assume so.
Yeah, Julia, we've
yes,
taken a different line this week on allergies, haven't we, than we were perhaps on Tuesday. So I think we can probably be clearer with where you need to book in. And we'll also be working with the acutes about how we can make sure that people with allergies have a smooth process to book in there. So if you've got allergies, bear with us. I think it's probably just worth holding off for maybe a few days until we've ironed out those kinks, and then we'll try and make sure we've got some really good access for you.
Brilliant, thanks Heather, that's fab. Thank you everyone for your great questions, really appreciated. Back to Grant to
Yeah, I'm not sure there's anything much to add. Just thanks to everyone for their time, and thank you very much for your ongoing commitment to care. And I think, as we'd always leave you, never forget what Paula said. It's your masks, it's washing your hands, and it's visors and goggles where required. Talk of vaccines crucial, but those basic infection control prevention precautions are absolutely vital. So that will always need to continue. But thank you for your time, and more importantly, thank you for your work. All the best. Bye.